Namaskar. Today evening, we are with one of the faculty of IAP. She is today's guest speaker. We'll be talking on dialectical behavior therapy skill for emotional regulation. It's a very important topic and a very new for all the IAPians. And so, if you listen carefully, definitely you will come to know many things about it. Dr. Preeti Galagali, MD, PGDAP, FIAP. She is a consultant adolescent health specialist and pediatrician. She is director, Bangalore Adolescent Care and Counseling Center, clinical lead, Adolescent Clinic, Manipal Hospital, Bangalore, Karnataka. She was chairperson of Adolescent Health Academy in IIP 2019. Many awards to her in the life. Current affiliation, she is Vice President of South Zone in Indian Academy of Pediatrics, Vice President Southeast Asia International Association of Adolescent Health, Co-Chairperson Educational Committee, IAH, Co-Chairperson Scientific Committee World Congress Adolescent Health, IAH, Secretary International Chapter, Member Adolescent Health Committee, Member Nomination Nutrition and Mental Health Vaccination, Youth Engagement Committee, SAHEM, USA. Lot of achievement, 200 scientific talk, 100 scientific publication, 3 award, 3 oration, 2 endowment lecture, 2,500 community program. Lead author of first IAP clinical guideline on adolescent health, co-author of 10 international position statement on adolescent health and well-being, co-editor of first IAP book on adolescent health as a Adolescent Health Pediatric Practices, co-editor of book Adolescent Counseling, Gold Medal MD SAM International Chapter, Karnataka Women and Achievement and Award. There are a lot of photographs. You can see that the activities done across country and at international level. Our aim of life to update the society. If you like, subscribe channel. Thank you very much. And now we start with Dr. Preeti. My first question is, what is dialectical behavior therapy and how it is useful in mental health diseases?
Thank you, sir. Thank you for that warm introduction. It's an honor to be here. Let me start just sharing my presentation. Sir, is it visible?
Yes, please.
Okay, sir. So thank you for that question, sir. And before I really start sharing some of my thoughts on this, I would like to acknowledge Society for Adolescent Health and Medicine, the Mental Health Committee, and Dr. Vinay Korpade, Associate Professor, Child and Adolescent Psychiatry, KLE, Belgaum. They have really helped me in understanding my concept about dialectical behavior therapy skills for emotional regulation. And I am happy to share a primer for pediatricians today. So, dialectical behavior therapy is actually, as I said before, it is for emotional regulation. So, uh, before we start any session of dialectical behavior therapy, we start with a mindful moment so that we can bring focus to what we are talking about. So let me start this by following 5, 4, 3, 2, 1. And I request all the viewers to just fall in what I am saying. So I'm going to say out aloud 5 things that I can see. So I can see Tuteja sir, I can see my laptop, I can see the picture of my kids, I can see a table and a chair. Next, I would request all of you for 4 things that you can feel. So I can feel myself, I can feel the table here, I can feel the laptop, I can feel a cup here. Next, 3 things that I can hear. I can hear my own voice. I can hear the sound of the fan. I can hear the traffic on the road. things that I can smell. I can smell my hand, I can smell the air. And one thing that I can taste my own saliva. So, this is a grounding technique. We have so many things that have happened during the day today. And to set our focus on one thing for a mindful moment, 5, 4, 3, 2, 1 becomes really important. So, coming back to your question, sir, about DBT. So, DBT is actually a cognitive behavior therapy. It helps in turning maladaptive thoughts into adaptive thoughts and healthy coping behavior, especially in moments of stress. And this was developed by Marsha Linehan in 1980s, and this was adapted for adolescents by Jill Rathers and Alec Miller in 1990s. So, in short, DBT is CBT with mindfulness and acceptance therapy, and we'll be talking more about it in the next few minutes. These skills have been shown very useful for borderline personality disorder. In fact, they were initially used for the treatment of this disorder. Also helpful for depression, bipolar disorders, eating disorders, post traumatic stress disorder, and substance abuse management. For teens, they're especially important in handling impulsive behavior, suicidal behavior, in managing extremes of emotion, extremes of behavior, so and also for staying in the moment and not getting lost in the past or in the future, and most important, for maintaining healthy relationships. These are simple skills with very high impact. Sir, I hope I have kind of cleared the question about what is DBT. This just to give you an introduction to DBT.
Hmm. So what is the importance of DBT in adolescence?
So, we are all familiar with the adolescent brain. We know that it is a work under progress. Lots of neuronal connections are being made in this period, especially between the age group of 10 to 24 years. So, I feel that this is a window of opportunity to train the adolescent in emotional regulation. And more so, we know that in the adolescent brain, the limbic system and the reward system, actually, which are responsible for emotional mood swings, also for enjoyment and pleasure, mature much more earlier than the reasoning and the logical center and the center for thoughtful planning, that is the prefrontal cortex. So adolescents have high emotional reactivity, which may sometimes land them into trouble. Like when they have high emotions, they may get violent, they may cut themselves, they may take drugs, they may binge on media, they may binge on food. So they definitely need some way to regulate their emotions. And DBT teaches them not to react impulsively, but to pause and respond. So, what does DBT do according to the neuroscience? It helps them to analyze their emotions and then name their emotions. So, when we say name the emotion, it usually tames the emotion. So, that is done by the amygdala. And when we label emotions, it helps to reduce the stress. The insula of the brain, what does it do? It helps to connect the mind and the body. So, how we are feeling in our mind, our body, like an increase in heart rate, sometimes headache in stress may occur. And when there is more emotional insight, our prefrontal cortex comes into play to control our stress. And hence, we learn how to respond rather than react. So for an adolescent brain, this skill is extremely important. And as we are teaching them the skill, what we are trying to do is we are trying to help them to use their wise mind, because they're always on an emotional high. They tend to use too much of emotions, and which actually clouds even their reasonable mind, logical thinking, because their prefrontal cortex is not yet developed. So when they develop their wise mind well using DBT skills, they have clarity, they develop intuition, balance, authenticity, and compassion. And we are very well aware, when there is wisdom, there is calm, and the chaos is controlled. So for adolescents, these skills are extremely important.
So, what are the looking to this all listening and understanding everything from you, Rakshap? But what are the principle of the DBT?
So, sir, DBT is built on the foundation of, like we all know, all mental disorders follow the biopsychosocial theory. So, when there's intense emotional dysregulation, what are the biological factors? In some individuals, they are more highly sensitive. They feel bad very quickly and they're very reactive. So if somebody teases them, they, instead of just kind of analyzing their emotions, they may go and hit that person. So they're very reactive and they're slow to return to baseline. So some of the adolescents, when they're angry with somebody, they stay angry for days together. And if they're in an environment where people are not able to understand them, or to understand that it was the teasing which triggered the hitting, and this adolescent is basically not a violent adolescent. If there are people who are blaming them, who are teasing them any further, and it's an invalidating environment, this emotional dysregulation even becomes more. So the adolescent doesn't feel understood, he doesn't feel validated, and people label him as a violent person, and he then tends to do more crime. So, what we are trying to do here is to control their emotions, teach them how to regulate their emotions so that they can cope in a healthy manner. Now, the core assumptions of DBT are very interesting and they are very, very heartening. People are doing the best that they can. So we don't blame people. When he is getting teased, he's getting hit by somebody, we don't blame him. We just say that it is his reaction to teasing. So we are not labeling him. We also say people cannot fail in DBT. People may not have caused all of their problems, but they have to solve them. So the teasing is not caused by him, but his reaction to the teasing he has to solve so that he can cope with it in a healthy manner. Now, DBT is founded on dialects. What do we mean by dialects? Dialects are two opposing views. I like my friend and I don't like him when he teases me. So there is no black and white. Yes, that I always have to like my friend or I always have to dislike my friend. So, how can I cope with emotions of too much liking, too much disliking also, and keep my balance? And validation is all emotions are accepted. So there are no good or bad emotions. So I like my friend and when he talks nicely to me. Oh, that's nice. It's a validated emotion. I dislike my friend when he teases me. That is also a valid emotion. So, validation of self, validation of others. So, my friend is teasing me because the teacher scolded him and he's in a bad mood. So then I validate his emotion. So understanding myself and understanding the other person. So we our life is full of dialects. They're full of conflicts, and this can cause a lot of emotional dysregulation in us. I'm terrified of change, and I'm terrified of staying this way forever. So this is one dialect. I am vulnerable, but yet I am powerful. I am successful, yet I was traumatized before. So, these are some of the dialects which we learn how to resolve, and this helps us to make ourselves a very happy person.
So, with so much details, my further question is has three components. What are its component of DBT? Then how many sessions are required? And the last in this question, third component is there any special adaptation for therapy for the adolescent?
Thank you, sir.
So
Those are very,
it's a
very
big question
important.
with the
Yes,
three
sir.
component.
Yes, yes, sir. Very important question, sir.
Yeah.
So, as I was telling you about dialects, sir, it is very important for us to accept the dialects and our reaction to them. And if they are bringing us some harm, how can we change? So, unless we accept that we have a problem, we cannot change it. Right, sir? So, that is what the one very important thing on which the four components of DBT are actually established. So, the four components are mindfulness. I should be aware of the present moment without judgment. Like I said, all emotions are okay. Then, how do I regulate my emotions? So, this is emotional regulation, which is the second component. The third is distress tolerance. If I have high emotions, I should not do suddenly in a reaction that I hurt myself and I hurt other people. So, how can I overcome in an emergency situations my high emotions? And as we know, the adolescent brains often the adolescent gets into a very, very high emotion, much more than adults. And as I'm regulating my emotions, how can I improve my interpersonal relationships? We have already decided that I'm not going to harm myself, but in that high emotional high, I should not harm other people also. And how can I share my distress with other people so that they can help me? So these are the four main components: mindfulness, emotional regulation, distress tolerance, interpersonal effectiveness. Now, very interesting part of DBT for adolescents is, sir, we know that adolescents are dependent on their parents. And I already told about the environment. If the environment is not good at home, emotions will become still much more high if parents do not understand. So, for adolescents, there is another component which is called walking the middle path. It teaches parents and adolescents for conflict resolution and how to negotiate communication so that conflicts are reduced and that emotional highs are reduced at home. So there is a parenting component for dialectical behavior for adolescents. The other difference is, sir, that for adults, these therapy sessions are over 1 year. But for adolescents, there is a shortened version for just 6 months. So it is shortened. So for individual therapy, sessions are once a week for 6 months. There are also group sessions, and these group sessions are once a month. Parenting sessions are once a month. So actually, the whole therapy lasts over 6 months. But how can a pediatrician use this, sir? Because that is also important. We are not
Yeah.
psychiatrists. We are not
Yeah.
psychiatrists. We can't do therapy. We are not even trained. So the idea of me presenting this primer is, sir, we come with cases of suicidal behavior. And when we make a safety plan for them and refer them to the psychiatrist, it takes some time for them sometimes to reach the psychiatrist. Sometimes they're not even willing to go to the psychiatrist. Can we give a shortened therapy in our clinic, the counseling components, which are very similar to life skills? We all do life skills in schools. So you can see, sir, that there is a lot of component of life skills in dialectical behavior therapy. So can we do these five components and maybe 5 sessions in our clinic to teach them the skills? So at least that it is something like giving an emergency help to the adolescent who has had a suicidal behavior. So this has been proved by research that this is the most effective training to prevent suicidal behavior. And I said before, it's an individual therapy skill training. Also, when it is done by a psychiatrist or a therapist, they also have team meetings and they're also available on the telephone for the patient always.
So what is the practical application? Can you narrate few cases in which
Sure, sir.
you
Sure, sir. So
use
from
this
so I must again
dialectical
say,
therapy?
yes, sir. It's only for, and what I'm saying here is not for, psychologists or psychiatrists and people who are trained. It is for common pediatrician like me who is sitting in the clinic. So there are some principles which we must follow. One is we must have goals. So what are we trying to help the individual with? We are trying to help the adolescent so that his emotional highs are under control and he doesn't do any self harm or harm other people. And when they come to us, we try to analyze their problem. Also, we try to analyze the solutions. And it is a good idea to maintain a record. When does adolescent get angry? What does the behavior does he do? What are the new things that we can teach the adolescent? So let me just take an example which would help us to understand better how to overcome emotions of anger, sadness, frustration, and develop interpersonal effectiveness. So this was a patient who came to me and it came with a history of self harm. So, what was the behavior change analysis? So, what happened was this child, this adolescent 15-year-old, used to believe in last minute studying. So, because he had an exam the next day, he did not have dinner. He was studying late in the night. Suddenly, he got up in the night because he was feeling hungry. He entered the kitchen. He dropped a glass. His mother got up. And his mother said, again, you are awake in the night. Now you are going to mess up the kitchen. And again, I'll have to clean it. I'm so tired. It is already 1 o'clock in the morning. So when she said this, the adolescent got very, very angry. And he threw a glass down, which broke into pieces. The mother got again very angry and she shouted at him. And he felt further anger, very, very ashamed of himself. And what he did was he went and cut himself because he did not know how to manage his intense emotions, which were triggered not once but twice by his mother. So, how do we help this adolescent to handle? I know there are lots of things that we can do, but the most important thing is we have to prevent self harm. Like I said, as a pediatrician, this should be our point one. How can we help him to handle these emotions? So, the first thing which is important when we are helping the adolescent, it goes by the mnemonic ABC, please. What does it mean? It means A stands for we should always have positive emotions. We should have hope that I can overcome these negative emotions. We should build mastery. So, mastery not only in control of emotions, but mastery in other hobbies. It could be badminton, it could be tennis, it could be singing. And we should always have a plan ready. How am I going to handle my emotions? And healthy lifestyle. We know nothing beats balanced eating, balanced sleep, getting enough exercise, also avoiding drugs. And if we have a physical illness like diabetes or maybe epilepsy, we are taking our drugs on time. So, this is very important for basic emotional regulation. So, this is something which we share with the adolescent. Next, we tell the adolescent emotions are like waves, they will come and go. Your main aim is to surf the emotions so that you don't fall in the ocean. So, John Kabat-Zinn, who's the father of mindfulness, he has said, you can't stop the waves of emotion, but you can learn how to surf. So what do we tell? The first thing is you must be aware that I am getting angry. Emotions are rushing into my head. I'm getting a headache. I'm feeling irritated. I'm clenching my teeth. I'm clenching my fist. So I am getting angry. So I have labeled the emotion. Now I am at the top of the wave. I should not do anything right now. I should wait. I should hold myself steady. I don't need to speak anything. I just need to be there. I don't need to do anything right now. What do I need to do? I need to analyze my emotions. I should be mindful of my emotions and my body reactions. So, what is mindfulness? It is paying attention on purpose in the present moment and non judgmentally. So, if I'm having anger and I just go out and take my phone and start scrolling, I have not analyzed my emotion. Why did I get angry? What is my body feeling? So it is very important to focus on only one thing at a time and not do multiple things. Now, suddenly we can't become mindful. So, what we have to train the adolescent is in anything that you do, it may be music, it may be dance, it may be even brushing your teeth. You must focus and you should be fully aware of what you are doing, and you should have attentional control. So this is something which we have to teach the adolescent. Now, when you're aware that you're getting very angry, you feel like cutting yourself because of your mindfulness, what are you going to do? You have already decided that you're not going to harm yourself. So, we don't want to push away the painful feelings. We are going to learn how to tolerate these feelings. And that is going to be important. We often tell the adolescent, don't get angry, don't hurt yourself. But we never tell them how to tolerate this intense distress. So, that is what we are going to teach them. Now, I am going to tell various tools. Now we can suggest to the adolescent, we can invite the adolescent to try these tools and see what suits him the best. So, just like we take care of a small baby, we need to take care of ourselves. We need to soothe ourselves with our six senses. We are very familiar with the five senses. I'm going to add another sense, and that is joyful movement. So, when we have intense emotions, what can we do? We can probably look at the picture of a father and mother who may mean a lot to us. We can smell our favorite perfume. We can take a favorite chocolate. We can touch our favorite teddy bear. We can listen to something which we love listening to, maybe Korean music, and we can move our body in dance or maybe yoga. So everybody will have their own self-soothing kit, and this is what they need to develop. And when they have intense emotions, maybe using their senses, they can calm themselves down. If this does not work, then we have another emotional distress tolerance technique which is called TIP. TIP stands for temperature, intense exercise, paced breathing, progressive muscle relaxation. So, what do we do here? Here, what we do when we are feeling intense, I'm feeling a lot of anger, I feel like cutting myself, I splash my face with cold water. And when I do this, my vagus nerve gets into action and that relaxes me. I can also place a bag of ice or cold pack on the forehead, use a cold facial roller, or take a cool shower. So we can suggest to the adolescent only one thing we have to be careful is that the adolescent should not have a heart block. Because remember, we are stimulating the parasympathetic nervous system. So we have to be very, very careful about this. Another thing which can be suggested to the adolescent is intense exercise to use up all our stress hormones. So, if you do intense exercise like running, treadmill, dancing, jumping jacks, important thing is it should be fast as you can do and as long as you can do, raising the heart rate to 180 beats per minute. This is also very helpful in controlling our high emotions. Other thing which is taken from pranayama is paced breathing, box breathing, belly breathing. One hand on the chest, one hand on the abdomen. When you breathe in, feel your abdomen bulging out. When you breathe out, feel your abdomen sinking in. And when we do that, we regulate our breathing, and when we regulate our breathing, we regulate our emotions. Sometimes when we get very emotional, we start breathing very fast, but when we regulate our breathing, we regulate our emotions. Another thing which can be done is box breathing, inhaling for 4 seconds, holding the breath for 4 seconds, exhaling for 4 seconds, and again holding the breath. Again, this is an invitation to the adolescent to try this out in the clinic. Very effective progressive muscle relaxation. When we get very angry or we get very tense, all our muscles get tightened. So, if we deliberately tighten and relax our each set of muscles, we get a sense of great relaxation. And when we are under high intense emotions, we will automatically relax ourselves and our emotions will come down. So, this is something again which can be done very easily in the clinic. So, what we have done, told this adolescent is that you can use all these techniques. And this adolescent said, for me, putting cold water on my face is the easiest thing to do. And that is what I am going to do right now to control, to do distress tolerance. So pause and respond. So, what was the trigger? The mother shouting at him was the trigger, right? So, next, when he has paused and respond, we tell him this feeling, what you have, is it under your control or out of your control? So he said, my anger is in my control, but my mother's anger is out of my control. Absolutely correct. But why did your mother get angry? Because you got up in the night, right? And you dropped that and you were eating at night and you had missed your dinner. So you were sleepy, you were hungry, that also increased your emotions. So then we talk to the adolescent about effective steps of problem solving. So remember, first we have to use distress tolerance. When the adolescent is calm, only then he can think about problem solving. So, what did this adolescent decide? He decided, okay, I am going to confess to my mother, I am going to say sorry to her, and I am going to go and talk to her. So, dear man is a mnemonic. In DBT, we have lot of mnemonics, and it tells how to talk to somebody so that you develop a good relationship with that person. Describe the situation, express your feelings, be assertive, reinforce the person ahead of time by explaining the pros of the change in behavior, be mindful, appear confident, and be willing to negotiate. Amma, I promise that I'm going to study before. I will try not to keep awake for at last in the night. I will also have my food at time. And just in case, sometimes if I drop something, mom, please, I don't do it deliberately. I'm sorry if I disturbed you that day. I will try not to do this again. And then the bond between the mother and the child really improves. So the principles of interpersonal communication are: give fast, be gentle, show interest, validate emotions of your mother, of yourself, have an easy manner, be fair, don't give too many apologies, apologize as appropriate, stick to your values, and be truthful. So when you tell the mother that you are going to study in time, you really follow it. As we go further, we also sometimes tell the adolescent to make this DBT house. And we tell them the foundation is, I'm not going to harm myself, I'm not going to harm other people. That is your values. The walls are the people who support you, that is your mother. The roof is your house where you feel very, very safe. The door is your emotions. Sometimes you don't want people to know that you're angry. You don't want people to know that you have cut yourself. But then you close the door, but you should know how to cope up, release the pressure through the chimney. And those are the emotional regulation and the distress tolerance and the interpersonal skills. So, this is one way. And I shall also quickly share two more cases. And this is for all the viewers to decide. A 16-year-old girl, she was an 11th grade student. She was an introvert since childhood, but she didn't want to meet too many people. She was a very good singer. Post COVID, her fear increased, and whenever somebody came to her, she just could not speak. There was so much of social anxiety. She had no other medical or neurodevelopmental disorder. So, which skill will be most appropriate? Of course, there are many things that we can work on, but that intense distress she feels when somebody comes. She's a singer, remember? So, box breathing or abdominal breathing will be the best for her. So we can tell her when somebody is approaching you, calm, chill, relax, and use abdominal breathing, and then start speaking to people. Another case, 14-year-old child with learning disability. His father was a mathematics professor, and this child was not doing well in mathematics. So, whenever there was a test, he used to have a panic attack. He should be breathless, start sweating, has palpitations. So, which is the best test, which is the best skill that we can use here? Remember 5, 4, 3, 2, 1. That is a grounding technique. So when you're in that very distressful situation, you ground yourself. Don't go into the future. What will be my marks? Don't go into the past. I've already done badly, but focus on the present. So 5, 4, 3, 2, 1 is very good. And on daily basis, to do progressive muscle relaxation so that the parasympathetic tone increases. So these are simple skills which all pediatricians can do in their clinics.
So what are the resources if somebody wants to know more detail about DBT?
Yes, sir. So I would recommend a book which was just released under the guidance of my teacher and your teacher also, sir, MKC Nair, sir. So this has a very good chapter by Dr. Vinayak on DBT and also many other techniques which all the viewers will find very, very useful. This is a fantastic manual, as I said before, written by Rathers and Miller on DPT skill manual for adolescents. It's easily available, and I think for pediatricians, if we have these two books, it would be really fantastic. As
Great.
I'm talking, sir, I'm very thankful that you have recording this very close to the World Mental Health Day, which falls on 10th October. And the theme of this is mental health in catastrophes and emergency access to services. And as you can see, sir, DBT is an excellent tool for all of us to adopt, especially during this World Mental Health Day. As I'm speaking, we are also preparing for the International Adolescent Health Week from 13th to 19th October. And the theme is strengthening adolescent physical and mental health, thriving inside and out. Once again, I feel DBT is fantastic to be adopted. Also, as I'm speaking, I invite all viewers to the 13th World Congress on Adolescent Health in Jamaica, where we are talking about DBT and also more skills. So, I'll just summarize what I have said in the last few minutes. Dialectical philosophy, opposing views can be present in a person, and this can result in conflict, intense emotional dysregulation, especially in adolescents. To accept the dialects and to be mindful about them and learn how to handle them with mindfulness, distress tolerance, emotional regulation, interpersonal effectiveness, and walking the middle path, partnering with the parents is very, very important. DBT can be done in your clinic, it can be done in schools, and it's a very, very effective evidence based method. In the words of Viktor Frankl, and this holds good for DBT, between stimulus and response, there is a space. In that space is our power to choose a response. In our response lies our growth and our freedom. So, no reaction, only responsiveness. And when we use DBT, we actually build a life worth living. And this is the title of Marsha M. Linhan's memoir. And she's the one who actually suffered from bipolar personality disorder. She has a lot of scars on her wrists. She underwent a lot of turmoil because DBT was not available for her, and that led her to actually develop this therapy. So let's all build a life worth living for adolescents under our care, sir.
Thank you so much. Thank you so much, Dr. Preeti.
Thank you, sir.
Uh, it is a new approach in the mental health disorder, uh, which we were only talking about CBT till now. So it is the DBT is also another, the next channel we have now for the pediatrician and adolescent physician who are working across country through Adolescent Health Academy in which we are part and parcel. And I hope that all the adolescent physician and pediatrician will listen to it, try to learn it, employ in apply in your clinic and in school where you are visiting, and I am sure that it will be helpful to prevent mental health diseases among the adolescents and children and will help the families. Thank you so much with us in the talk show and hope that again we will have some another session with you to update our members of Indian Academy of Pediatrics. Thank you so much to be with us. Thank you
Thank
so
you,
much.
sir. Thank you so much. And what you said before about DBT, I second each and every word that you spoke, sir. Thank you so much, sir. Thank you once again, sir.
Thank you. Thank you. Thank
Bye
you.
bye, sir.
Bye.